Good evening and welcome. Good evening and welcome. This is Prescription for Life here on Nationwide 90 FM. It's a show that is coming to you live on this Thursday evening, Thursday, October 24. Well, Tuesday, October 24. Where did I get Thursday from? Tuesday, October 24, 2023. My name is George Davis, and I am sharing the stage with the gentleman, the expert, the first black man to pilot an aircraft. The first black man to pilot an aircraft, Dr. Andre McDonald. Good evening, sir.
Yeah, listeners, I mean, at this point, I want to say that a very good friend of George and a very good friend of myself and a very good friend of all the listeners to Nationwide requested this topic, George. You know her very well. It's a good friend of yours.
Yeah.
She said to me, she has been asking me for weeks, George.
Yeah.
Every time I see her, she's near and dear to you.
Yeah.
She has been asking me for weeks. She said, Doc, talk about the leg vein them because them giving me trouble. We have answered the lady's call.
Yes.
And I'm sure we're going to be answering a lot of calls
Yes.
on Nationwide tonight.
Him dodged the plain introduction, but it's all right. I got a special request to tell you good evening from Sister Mary Andrew. I met her at church, at Christ Church in Vineyard Town on Sunday. She says she's a committed listener. She really enjoys the information that you share, the way you do your program, and she wants to tell you hi.
Yes,
all right?
yes,
So, sister,
yes.
I've done well by you. I've kept my promise, all right?
And tell Sister hi for me.
Yes, man. She's listening to you, so you're telling her hi directly.
Yes.
All
George,
right.
I never knew you went to church. I mean,
Doc. Doc. Cooler, man.
thank God for sister.
There you go. All right. The topic for discussion this evening, as Doc said, chronic venous insufficiency. Remember last week when Doc said this was a topic for this week? I asked him, well, run that again. Chronic venous insufficiency. I've never heard of this, but I'm sure many of you know people suffering from this, and many of you have seen people where their legs look a particular way. I'm sure Doc will tell you, well, yeah, that represents, what you saw represents shades of chronic venous insufficiency. So the obvious place to start, Doc, is with a definition.
Definitely. And I'm saying, George, you did absolutely well when you say shades of chronic venous insufficiency. Chronic venous insufficiency, George, is probably one of the most, if not the most prevalent healthcare condition that is overlooked by healthcare providers. Mm-hmm. In other words, physicians, and you notice we never use the words missed or did not see or fail to identify. We say overlook, because they do see it a lot, but they just don't bother with it. Mm-hmm. And the issue is, you got it absolutely right, because you spoke about shades of chronic venous insufficiency, and what the listeners must know, that it represents a broad spectrum of venous disorders. You did absolutely well with many shades, George. Mm-hmm. No pun intended, because the skin itself has many shades. Yes. And you can look at the different shades of the skin and speak to the chronicity, or you can speak to the advanced stage of the disease. So it's an excellent word to use. As chronic suggests, it's long term, over time. Venous mean veins, which are the superficial blood vessels closest to the skin.
Yes.
And insufficiency mean the inefficient functioning of these veins to achieving their maximum productivity. And the role of veins, especially in the extremity, is to bring blood, George, from the lowest area in the body against gravity back to the heart. It is this role of veins that is affected in chronic venous insufficiency, and when this is affected, a myriad shades, many different types of venous disorder results. You did say you never heard of CVI, chronic venous insufficiency, before, and you're right, so many people haven't. Mm-hmm. Yet still, George, if you should say varicose veins or spider veins.
Yes.
Or
Everybody know that.
Everybody knows that. But as we said in the definition, the varicose veins or the spider veins represent a shade or some shades of the many shades of CVI.
Yeah. All right. So, now that you've set it up like that, what's the prevalence of CVI, chronic venous insufficiency?
And we did say at the start that it is probably the most, one journal described it as probably the most prevalent health condition that is overlooked by physicians.
Right.
Because it is present in up to 2 in every 3 persons, 66%. Can you believe it? There are 3 of us in here. 2 in every 3 when it comes to the spider or the small veins.
Yes.
1 in every 2 individuals when it comes to small varicose veins to the bigger varicose veins. 1 in every 3 persons when it comes to the long tortuous varicose veins. And of course, we see that about 1% of individuals tend to develop ulceration, skin discoloration and ulceration, which is where it gets really, really bad. It tends to affect females more than males, and we're going to see why in general.
I was just going to ask you that because I was going to say to you that when I was a boy, I noticed, well, the first thing, the legs, it was my grandmother I saw with those veins. And I asked her what they were. She never had the language to say is chronic venous insufficiency.
Exactly.
You know? So I saw that there, and then I noticed that I always saw the spider veins in women.
Yes.
So I wanted to know if women were more likely to have that issue than men, and why.
Much more likely. As a matter of fact, when we talk about the history and we look at risk factors in a little later on in the program, just being female is a big risk factor. And many persons who are looking back now to when they were youngsters like yourself, George, I remember that myself. I mean, of course, you know, you have all the listeners who may come to see me on a daily basis. When they look at me, they said I must have been a youngster a very long time. And then they say, why did George do this? This is not believe you were just a youngster yesterday. But
Yes.
when I was a youngster, George, you're absolutely right. I am trying to remember. When we started to look into this topic last week,
Yes.
I tried to remember a man
Yes.
who had varicose veins when I was a youngster growing up, and I can't
recall
remember.
none. Yeah. Just the women alone.
It was always a woman's thing, and men can have it too, but it definitely predominates in females. As a matter of fact, women tend to have mild to moderate disease, which is present much more than severe disease. And severe disease tends to be present more in men.
Yeah.
And we can discuss why later. Black, white, there's no ethnic differences.
Yes.
But what we know is that the disease tends to be more prevalent in the western part of the world, which is where we are,
Yes.
as opposed to the eastern and African parts. And it tends to increase with age. So people who are 50 and over tends to have it.
Yes.
One figure showed that 25 million persons in the United States suffer now from chronic venous insufficiency.
Yeah, there's a question, Doc, and I want to know if I want the right. I like to get these things right, you know. So here goes. I've never seen veins varicose in the arm. I've always seen veins varicose in the legs, especially
Yes.
the lower legs. Yeah?
Yes, yes.
So is it because, and so a part of the first answer you gave, you said that the gravity and the blood going up to the heart and the effect of that process being interfered with and so forth, which is what causes the veins to varicose. So is it that because the arms are closer to the heart than the legs, is that the reason for the arms not varicose? Am I right?
That's an excellent question you're asking,
Yes.
George. It's you're ahead of me in this one because I wanted to explain that more than anything
Well, we
else.
can explain it.
And
Keep that then. Keep
All
that
right,
then.
okay.
Keep that then. Keep that then. Keep that then. We're gonna take the break. The producer has saved me from having Doc give away his answer early. We're talking about chronic venous insufficiency. There's a disease, chronic venous disease, which Doc will speak about on the other side. But we're talking about the issues around the things we call varicose veins. Those green veins or blue veins, depending on your skin tone and the shades and everything. We're explaining what is happening, what causes all of that. And of course, at the end, Doc will talk about treatment. Welcome back to Prescription for Life here on Nationwide 90 FM, coming to you live on this Tuesday afternoon, or Tuesday evening now. Tuesday evening. It's Tuesday, October 24, 2023. I am working alongside the great Dr. Andre McDonald, the man who discovered insulin. Yes. I knew that one would perk you up. All right, this evening we're talking about chronic venous insufficiency, and CVI is what Doc says, chronic venous insufficiency, and the whole condition concerns the varicose veins, all of that. He's explaining all of that. He's talking about what causes it and the prevalence in men and women. He says ethnicity doesn't matter, although crucially he says it's more prevalent in Western countries. That's where Jamaica is a Western country, more prevalent than in the East. I don't know if it has more to do with our sedentary lifestyle. I don't know, but Doc will explain that. All right, so Doc, you're up once again. Chronic venous insufficiency, and I teased chronic venous disease before we took the first break.
Yeah, and you're so right. Later on, when we look at risk factors, we will see exactly why it is more in the West than in the East. This is the favorite part of the program for most persons who listen to Prescription for Life. Certainly, the Prime Minister, as he told me, he probably might be listening tonight, but when he saw me, he said, boy, when he finished listening to the program, George, his ability to explain the pathophysiology or how it occurs is phenomenal.
Excellent.
You know? And normally what happens, George, is that blood flows through veins from the foot bottom or the extremities up to the heart. Once it is going back to the heart, it is going through a vein. Very important to understand. And that is supposed to be a one-way flow. Now, normally, George, if we look at one-way streets, you know that the street is a one-way street because it has a one-way sign. If there was no one-way sign, George, there's no way we would know. It doesn't matter which country you're in.
Yes.
You are not going to know that it's a one-way street. You will look at the sign. The thing is, George, if those one-way signs are taken down, then what would happen is that persons would be going up and down the street in whatever way they would like to. Now, what is important is that there are valves in veins that act as one-way signs and one-way doors. They only allow blood to flow in one direction.
Yes.
And if it is that somebody takes the one-way street signs down, or move or remove the valves that will allow blood to flow one way, then just like the cars, the blood will decide that it can go in the opposite direction.
Yes.
So if somebody is standing up, George, once they're standing, blood is supposed to flow up against gravity, understanding that the force of gravity is attempting to pull the blood down.
Yes.
But the valves direct them up. If the valves are not working to direct the blood, then gravity is going to predominate. And what now happens if the valves become damaged? And I want the listeners now to think that what could damage the valves? Because later on when we look at cause and risk factors, we're going to look at all the issues that can damage your valve.
Yes.
But anything that damages the valves will cause the blood to not go up towards the heart, but to now pool in the legs. Can you see that?
Yes, man. I'm visualizing it.
And if the pooling gets more and more and more, George, then the veins are going to dilate. They're going to open up.
Yes.
They're going to get bigger because they now have to support a larger pool of blood.
Yes.
As they dilate, then they now stretch to the point where they become visible in the skin and attempt to push out of the skin, and now they can be seen. Not only that, George, when they dilate and the amount of blood in the veins increase, it increases the pressure on that column of vein.
Yes.
As the pressure increases more and more, because more blood is dilating the veins more and more, the smallest blood vessels called capillaries that had to unite to become veins burst.
Yes.
They're smallest, they're thinnest, and they can't take the pressure.
Yeah, man.
When they burst, George, what happens now is that the contents of blood, the iron, the red pigment, the hemosiderin, the heme comes out. And once they come out of blood, remember they should have been in the blood vessel, George.
Yes.
They're now coming into contact with your skin.
Yes.
They're not supposed to be in contact with your skin.
Yes.
So the listeners now who is affected by CVI, chronic venous insufficiency, is going to tell that they start feeling itching.
Yes.
Burning.
Yes.
Irritation. And as it damages the tissues, which is the skin, it makes them more friable. It's easy for them to burst. And you're walking around the house and you bounce your foot on the foot of the chair, on the foot of the table, on the foot of the dresser, and it bursts. And what happens there is that an ulcer develops because the skin is open.
Yes.
And not only that it develops, it bleeds because the blood vessels are open. The same red pigment, the hemosiderin, the heme, all the constituents of blood that are draining out in the skin, not only causes itching and irritation, but it causes discoloration. So what we would have seen as a boy is not only these enlarged tortuous veins in the legs, but what we see is the legs looking black, discolored, right? We also see the legs looking swollen because those capillaries, those fine, thin blood vessels leak not only blood, but the fluid that holds the red blood cells also leaks out into the soft tissue, so it causes swelling of the legs. So you have what you call edema of the legs. So what you see now, and persons are visualizing persons with this, are persons in their community with swollen legs, discolored legs, ulcerated legs, bleeding legs, right? And the persons who are crying for pain. And all of this is because the pressure in the leg increased due to the pooling of blood secondary to the damage of valves. So the listeners would understand that anything that damages the valve can cause this challenge.
Yes.
You teased on chronic venous disease as opposed to insufficiency. Insufficiency speaks to the valves being inefficient.
Yes.
But disease of the vein speaks to anything now that can affect the valves, that can affect the vein itself, that can obstruct the vein and results in what you call venous hypertension. Anything now that can cause the pressure of the vein to increase to the point where it initiates that cascade of events that I just spoke about will cause chronic venous disease.
What a brilliant explanation. Thank you very much for that, Doc. I visualized every sentence as you articulated that point, that answer, that explanation. All right. Have you noticed any enlarged veins in your legs? If you have, give us a call. No? Talk to us. Tell us what you're feeling. Are you feeling constant itching? Are you feeling a burning sensation in your legs? Is it worse at night time, at morning time, when you sit for long periods, when you're standing in the bank? Tell us. Yeah, give us a call. 630-9371, 630-9372, 9373, 9374, and 618-8255.
So that brilliant question that you asked now, George, why does it not happen in the hand?
Yes.
It can, and it does.
Oh?
Just not as much.
Yes.
because the pressure gradient that exists in the lower extremities, which are always under gravity, does not present itself in the upper limbs. And which is why it is so important that you looked at the venous insufficiency versus the disease process. Now, the disease process can take place in the hand.
Yes.
Because a clot can find itself in the hand and it can block a vein, it can increase the pressure in the vein, and it can cause the same venous hypertension, which means high blood pressure in the vein or high pressure in the vein. And when it causes the venous hypertension, that cascade of events that we just spoke about can take place in the upper limb.
Yes.
It is not as common in the lower limb, but it can happen.
Yes. All right. So we're talking about chronic venous insufficiency, and Doc has found his best stride, and he's explaining everything to you, and his words have manifested into sharp, bright pictures. We're going to take the break. When we come back, we're going to talk about some risk factors. Yeah, we're going to dive into that and get you more intimate with what's happening where those spidery veins, those varicose veins, chronic venous insufficiency is concerned, and how it's affecting your overall health. Soon come. Welcome back to Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of Suretime Medical. They're at 10 Trafalgar Road in New Kingston. You can call them 394-5433, 394-5433. That's the 24-hour lifeline. A general visit at Suretime costs only $3,500. I repeat, a general visit at Suretime costs only $3,500. There are many places in Kingston you can get lunch for that. You understand? You can find out what's wrong with you or what's right with you at short time, as it the case may be, for only $3,500. 24 hours, they're open. They facilitate house calls. The medics there, you can get an ambulance from short time anywhere you are on the island and in quick time. And if you're having an event, they'll provide standby coverage for you at that event. Call them, tell them that you know George Davis, you and him used to go university together, and you'll get an extra discount of, well, I'm not going to tell you on here. You need to go first and engage, and then they'll tell you what's happening after that. All right? Jacqueline, beg your pardon, not Jacqueline, Veronica, not Archie or Betty, it's Veronica online. Good evening, Veronica.
Hi, good night, George.
How you do?
I'm not doing too bad.
Excellent. Doc is waiting to talk to you. Go ahead and talk to him now.
Good night, Doc.
Good night, Veronica. How are you?
I'm not bad. All right, here, what is my problem? I end up with a blood clot in January. I was admitted in the hospital. I come out back, but like in the morning when I wake up, it have a burning sensation in my foot.
Right. And when you say a burning sensation in your foot, what do you call your foot? Between the knee and the ankle,
No.
or below the ankle?
Right at my leg.
Right at your leg. So
Yeah.
on the inside or the outside?
On the inside.
The inside. The inside. Very important information from Veronica. All right, so I'm thinking, Veronica, that clot that you have in your legs, the doctors are treating that with medication, right?
Yes.
Right. And I am sure that probably before you got the clot in your legs, they would have presented you with a reason for the reason why you had that clot. Now, so?
Oh, they were saying I have some vein problems.
You have some vein problems. All right. Tell me quickly, though, are you overweight?
Yes.
All right. And another time you can give us by how much. But do you have any other chronic illnesses like high blood pressure, diabetes, or high cholesterol?
No, diabetes.
You have diabetes. All right. And that clot that is in your leg, they did an ultrasound and found that clot, right?
Yes.
They did an ultrasound. And now you're being treated for it. You take the medication every day, once a day?
2 times a day I take it.
Okay, you take that one 2 times a day. And you taking any other medications with it?
No.
Apart from the diabetes one?
only
The diabetes one, right?
the diabetes one and the one for the not the blood clot, the for the vein.
For the veins, right? Because I figure you're taking another type of medication, right? Right.
No, it's just the one for the sugar and the blood clot and the one for the vein.
So that's what you're talking about. Yeah, man. So we're saying the same thing. All right. No issues. Listen to me very, very carefully now. You had a blood clot in your vein. And I want the listeners to know that one of the risk factors for chronic venous insufficiency, which is what we're talking about, is a blood clot. A blood clot. You spoke, George, about chronic venous disease, and we spoke about the valves being damaged. Now, it is very possible for that blood clot to do one of two things. It can damage the valves, for sure, and it can also block the veins so that the pressure in the veins build up. So you have what is called venous hypertension, the same thing we spoke about, and it can even result in the veins becoming inflamed. We actually call that thrombophlebitis. The good thing for Veronica is that the reason why you want to treat that clot and arrest it in the vein is because you don't want it to go up to our lungs and result in what you call a pulmonary embolism, because that can be detrimental for her. She's feeling burning, and we spoke about why she may be feeling burning.
Yes.
But I asked her about other illnesses because the risk factors that we're going to talk about include chronic illnesses.
Yes.
And she spoke to diabetes.
Yes.
And Veronica, I want you to know that diabetes itself, Veronica, and the listeners, can cause burning.
Yes.
There is something called peripheral neuropathy.
Yes.
And so you can get burning from diabetes. So one of the things we want to ask Veronica, how controlled is your sugar? And you would know that because you would have done something called a HbA1c. Have you done that?
No.
Right. So I want you to ask your doctor the next time you see him, what is my HbA1c? You want to know how controlled your sugar is, because
Okay, because I go back to him on Thursday.
go to him, beg him to do that, because Veronica is so important, because the burning in your leg can result from the clot you have there, can result from the diabetes. And now I'm asking you, do you have swollen veins on the legs?
No.
You're not seeing any swollen veins, any little small veins?
It's only when I did come out the hospital.
Right.
It is swollen, but from that it's not swollen again.
So it is not swollen again?
No.
All right, but it was swollen before, right?
Yes.
Then that is good. So what would have happened at the time when she was coming out of the hospital, having been admitted there, is that the clot in the veins can increase the pressure so that veins can be swollen around where the clot is. And the clot is usually, George, in the deep veins, but it can be in the superficial veins too.
Yes.
What we call deep vein thrombosis, but it can be in the superficial veins too. And it can cause the swelling. She's on treatment, so the good news is that the swelling would have been improving. But you notice she said she feel burning.
Yes.
So the burning could be due to CVI. But I am thinking in her case, she needs to look into her diabetes,
Yes.
because the burning can be due to uncontrolled diabetes.
All right. So Veronica, what we're going to tell you to do, we have to run, is that on Thursday when you go, doctor, just ask him about that HbA1c.
Okay, thank you then.
All right. Thank you very much for calling. All right.
Okay.
Okay, Veronica, take care. Yeah, man. All right. So the HbA1c will tell a lot, because doc says the diabetes could be the source of the burning. All right. So doc, I want you in the time we have left onto the break to talk about the impact of being overweight, family history, aging, because I would imagine that young people in the prime of their life, especially those who are athletic, wouldn't have that issue. I can't recall an athletic 20-year-old lady with varicose veins. For people who work at the call centers or work at the security guards who sit for a long time, I'm sure they are more prone to having this issue CVI than other people. So lump all of those and give me an explanation.
You said it so correctly, George. I have a 20-odd-year-old patient, female patient, it had to be female, I guess, who has varicose veins, significantly so too. Many varicose veins, yes, but guess what, George? She is obese. She is obese. When we did our HbA1c, that was also high. She's unfortunately also diabetic. And her cholesterol profile also revealed that her cholesterol was also high. She also has a family history of varicose veins. Her mother has varicose veins. As a matter of fact, when it comes to family history, you have a 90% chance of having varicose veins if both parents has it. And then now, look at this. If one parent has it, then the female has a 62% chance of having it. Her mother, she says her mother has varicose veins. She doesn't know if her father had it.
Yes.
But she now has a 62% chance of having it because her mother had it. And
Is her mother obese as well?
Her mother is overweight
Yes.
as well. And I tell you something, George. Look at men, for example. If my mother had varicose veins, I only have a 25% chance as a male.
Yes.
With having it. So
And the prevalence for women is what?
It's 62%.
62.
Yeah. And if both parents has this, a 90%. If no parent has it, then there's a 20% chance. So it cuts significantly. Females get pregnant. Females are on birth control. Females tend to be more overweight. So because of that, they are more at risk. This is why you see a lot of females develop varicose veins during pregnancy.
Yes.
And it tends to hang on.
Yes.
Because the weight they put on is not always shed.
Yes.
And so their BMI and an elevated BMI is a significant cause. So this is why females, even though they're affected more along the genetic side, the conditions now that prevail on them throughout life makes life worse. The older you are, George, definitely. And what we're seeing is that the older you are, the more you work, the more you have chronic illnesses and chronic diseases. High cholesterol is a critical condition that must be looked at. And when persons come with chronic venous insufficiency, this is one of the things that is often done, the HbA1c and the high cholesterol, because those are associated with damaging valves.
Yeah.
And that is also a big part of family history. Sitting for long periods and standing for long periods. The professions in the Western world
Yes.
are associated with sitting and standing.
Yes.
And you spoke about the call centers.
Yes, sir.
And you're absolutely right. So this young lady who came to me works at a call center.
There you go.
And she sits for long periods of time. And also the security personnel, persons who have to stand for long periods of time, who tend to be on the obese side, tend to have it just the same. If you have any prior trauma to the lower extremities, it tends to happen. And if you are a smoker, it tends to increase your risk. The more children you have, again, this is for females, is the higher the risk. One of the things we have seen is that there are persons who have undergone now, are we talking about chronic venous disease, is persons who have undergone like radiation therapy. There are other challenges that you can find with the veins.
Yes.
Veronica spoke about clots.
Yes.
There are congenital conditions that has what you call arteriovenous malformations, which mean the artery and the veins get a little bit entangled and sometimes they communicate. They shouldn't. So it'd be two separate conduits.
Yes.
But all of these can cause it. They are congenital conditions. You did say that you don't expect to see a 24-year-old young, slim, athletic person. But one of the things we're asked to do as doctors is to ask about the age of onset for varicose
Meaning the
veins
first time you saw
or
it, you saw it
CVI.
emerge, right?
And if you notice that this person, it happens between teenage to early 20s, then there is a congenital condition. It's a long name because a couple of scientists came together to describe it. And we won't bother the listeners with the long name, but it's usually that condition that is affecting people early.
All right, we take our final break. When we come back, we finish this discussion talking about CVI. More after these. Back with us on Prescription for Life, brought to you by Suretime Medical. You can find them at 10 Trafalgar Road in New Kingston, 394-5433. That's the 24-hour lifeline. That's a number you call if you need an ambulance. That's a number you call if you need to schedule a doctor's visit. A general doctor's visit costs only $3,500. That's also the number you call if you have someone at home who is in need of care and may have to spend the night. Don't fret, Showtime facilitates that, so they will take care of that for you. All right? So we're talking about the symptoms, and we'll talk about treatment because I know you want to hear that part. So, Doc, insofar as the symptoms are concerned.
So we did say, so when you evaluate a patient, an evaluation of any patient, George, involves talking to the patient, which is taking a history.
Yes.
It involves examining the patient, which is to do a physical examination, both general and specific to the complaint. And it involves investigating the complaint so that you can arrive at the correct treatment protocol. We said at the start that when it comes to the history, the age of onset was very, very important. And persons who present with chronic venous insufficiency is going to present because they see something on their skin that looks uncosmetic, and usually when they come to you it's because they just don't like how it look. It just don't look good. Either the skin is discolored or they see some swollen veins. And ladies normally come, and I say ladies because I cannot, I'm trying to remember when I saw a male patient.
I never.
Yeah.
And it's a hell of a thing for the ladies, especially the ones who have nice legs and like to wear shorts.
So that's
and
it.
You know, it's
Go to the beach.
Boy, I tell you. Yeah,
Go
man.
to the beach
Yeah,
and wear shorts. So this is why they present. And or some of my older patients will present, again, females, usually, what a lady presented to me recently with the condition, and it's your friend, is a female also. And the thing is that they will tell you that they feel pain and burning
and itching.
Which is relieved by laying down in the bed and elevating the legs. It's a very important thing. They will tell you, and you'll ask them, you'll say, ma'am, so what happens when you walk? When you walk, does it get worse? And when the patient walks, George, it usually does not affect the pain. Why is this crucial? Because there is something called claudication, and we're talking about arterial claudication, so we're talking about the veins. Patients will tell you that if they have to walk from here to half a tree, the pain gets worse. And that tells us that the pain is coming from the arterial side, not the venous side.
Yes.
But when they walk because of the venous pain, it actually gets better. And that is something very crucial to know. And this is something that the patients will come and they will present. Apart from the fact that they'll tell you that they'll feel pain in the leg, they'll feel heaviness in the leg or some sort of aching. They'll come because the legs are swollen. They'll come because it is discolored, as I said before. Usually, it is the symptoms of cosmesis that drives them to the doctor. Now, when you examine them, and it is wise for you to do both a general examination and an examination specific to that lower limb, you must look to see if you're going to see the veins that they described, whether the small ones that people call spider veins, or the bigger, longer, tortuous ones that people call varicose veins, or you're going to look to see if there's leg swelling, discoloration, ulceration, or bleeding. All of that you can see when you examine the patient. It is crucial that while you examine that lower limb, that you look at the ulcer, because not all ulcers are venous ulcers. I did ask the lady whether it was on the medial side or the lateral side, what we call the inside or the outside.
Right.
The inside is mostly venous ulcers, but the outside is mostly arterial ulcers. So you have to look as a doctor,
Right.
because the arterial ones tend to be because of peripheral vascular disease, sickle cell, among other things. So you now have to look at the doctor. They're diabetic ulcers. You have to look at the doctor. What am I looking at? And it has to clue you in to say, how am I going to investigate this? You have to look at the pulses, George. You have to see if the blood flow is getting where it needs to go. And Veronica was such an important caller, because you have to assess for neuropathy, which is a little tingling and the burning pins and needles that you will get in diabetic patients. And she is diabetic. Very important. There are all sorts of tests we can do. One of the very common ones that I had to do on the patient recently was called the Trendelenburg test, which is when you put the patient on the bed. And most patients with varicose veins will tell you, doctor, put me to lay down flat, elevate the leg up in the ear about 45 degrees, squeeze a little area around the groin to try to stop. After you drain the blood out of the leg, to try to stop. It's like you close off the veins there,
Yes.
to try to stop blood from flowing back down.
Yes.
Ask the patient to stand up. And if you see blood flow back down in the leg, that is telling you that, wait, something is leaking.
Yes.
Something is not right. And it is cluing us in to say, what is my approach? Where am I going to do? But there are a lot of other tests that we will do. We examine the patients, George. And after we examine the patient and we see all of that, we say to ourselves, all right, something is wrong here. We pick up some general things. We pick up some specific things with the legs, and it clues us now to how we're going to investigate the patient. And when it comes to a patient with varicose veins, especially advanced disease of the whole spectra when it comes to chronic venous insufficiency, some of the times you have to investigate broadly and specifically, right? In modern times, I'm going to jump straight to an investigation. So normally, what we do as doctors is that you have to start with your blood investigations. We know that a complete blood count can show us infection and anemia. We know that kidney function test is very important to look at kidney disease, which can present itself sometime in the swelling of the limbs that we're going to see. And sometimes it's both of them that are swollen. I want to tell you something about varicose veins. When patients who have one limb affected, usually within 5 years, 50% of them have the other limb affected.
What?
Even if you treat the other limb. So, they're going to end up with bilateral anyway, most people. And I want to tell you, some of the times you say the both legs being swollen, you have to think about kidney and heart disease.
Yes.
So we have to do kidney function and cardiac tests to see, why are these legs swollen? I want to tell you something quickly, George. The HbA1cs, Veronica, has to be done. Sometimes HB electrophoresis, depending on the level of leg ulceration, HB electrophoresis checks for sickle cell.
Yes.
And you certainly want to do their cholesterol profile. Bloods are important, but I tell you what I jump to very quickly, and a lot of doctors will jump to quickly. We don't need to do so many of these tests that we used to do before, because we have ultrasound imaging now where we can look at the veins, and the ultrasound can demonstrate to us whether there is what we call reflux, whether blood is going in the wrong direction. So it shows us if the valves are bad, and this can give us a lot of information and to say how we are going to approach. I want to tell you quickly, George, that if the thing is if the CVI is not advanced disease,
Yes.
simple things like elevating the leg, clearly that is going to release the pressure, right?
Right.
Simple things like exercise to decrease your body mass index. skincare, simple things like compression stockings, which is
I was
what
going to ask, I've been dying to ask about it. I
Yes.
see old people always know well,
and
old
you used
and
to
young.
wonder, but you see
Yeah,
it. We see it
yeah.
a lot, and we used to see it especially when we were children. We still use them, and what it is just stockings that ensure that the pressure is gradually changed to ensure that the maximum pressure starts at the bottom and gradually releases as it goes up more. So, in other words, it acts almost like a pump to send the blood flow up.
Yes,
So
yes.
the compression stockings are used.
And to resist gravity.
Yes, yes. If you have the little spider ones or small varicose veins, we can use what you call sclerotherapy. It's a simple thing, George. We take a needle, inject some solution inside the veins. What it does, it creates a reaction, a irritating reaction. It causes the veins to lock together and shut off and close off. We can we can do that for veins, or we can do ablations where we actually remove the veins, take out the veins. We can look at that place we squeezed. We call it the saphenofemoral junction. Very important, big junction there that when we squeeze it, if the vein fills up, as I was telling you, it tells us that there may be incompetence. You can actually do a surgical repair. There's so many things that can be done now that can be both medical and surgical therapy. The truth is, George, a lot of people have these veins walking around and you don't need to. Your skin, I remember a patient I had who had the discoloration in her skin, and she said she was using some medication for some long period of time and it wasn't working. The bottom line is that she came. If the right things are done, and the patients, the listeners of Nationwide just need to go to their doctors. It can be treated. A lot of the veins can be removed. The color of the skin can come back. I've seen that too many times.
Yes.
To where it was before.
Yes.
If the time and patience is spent to understand what is happening and treat the condition.
And go to the doctor. All right? Suretime Medical, they're responsible for it. I want to thank Dr. McDonald very much for his contribution this evening. And to remind you that for only $3,500, you can see the doctor at Suretime Medical. And they have plenty of doctor up there, not just one. Yeah? 906-7873. That's the landline number. 394-5433. That's their 24-hour lifeline. Thanks to our producer, Mrs. Latoya Lawrence. Thanks to thanks to the lady responsible for all of Doc's business, Michelle Dean. Sometimes she's not here, but most times she's here. You know what? I should stop talking about Michelle Dean now. And thanks to our technical man, Andrew Anderson. This has been Prescription for Life here on Nationwide 90 FM. Good night.
Prescription for Life was brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906-SURE.